My name is Stephen Ramirez, and I'm currently the Chief Information Security Officer at U of L Health. We have 9 total sites, so 5 hospitals and then 4 outpatient clinics, roughly 12,000 employees, and we're an academic medical center with a trauma one and also our transplant center. Security is fundamental to healthcare, just out of the wealth of data that we have. Everything is interconnected, and COVID-19 really helped push the hand of the digital transformation throughout healthcare. But being a research and academic center, we're pretty innovative in having a lot of technologies. We do have a lot of IoT medical devices and other things connecting to our network, as well as BYOD and different devices that people need to utilize to deliver care. That makes us a little unique, and that gives us a wider attack surface and really requires our team to really understand our end users and the support services that we're doing, that anything we do can have an upstream or downstream impact to patient care, patient operations. Having our partnership with the Herjavec Group was really helpful in that we did have certain components as part of our managed service. So that really helped us to really scale and not have to send our security operations home, that they really were business as usual. That really enabled my team to just adapt to the changing environment, and then us just continue to monitor and ensure we're living up to our security posture that we had prior to the event. Having that support structure to minimize the movement of a lot of pieces that a typical in-house SOC and managed service would have to do. Having experts that do that all day, every day, really enables you to focus on how you can optimize and focus on your day-to-day risk. One of the reasons that we went with the Herjavec Group was their multitude of services that they provide, from full managed service to really, tailored services that you need. So on top of us having various managed services, we also looked at incident response retainer in the event we had to go in and do any deep diving, to have that bench of professionals that could dive in and do that forensic work for us, but also on offensive services that would really enable us to not only just go out and do our normal day-to-day security operations, but really where we can go fine-tune and find any gaps in our current security posture. That was really part of our overall defense in depth strategy, not only having the processes, policies, security controls that we were looking at, but also baking in the components of managed service to, if something were to go wrong, how we can leverage a incident response retainer and all of the work that we're doing with them, but also on the proactive services, that's key in this day and age to really help mitigate risk and really have that extra set of eyes to continually boil the ocean to see where you can better enhance your security posture as an organization. A great other value add to the Herjavec relationship is that we're able to have that Herjavec family, we like to call it. So being able to interact with fellow customers, that if somebody else, on the West Coast, for example, is looking at a tool and I'm using that, or has a question around a process on what we do for third-party risk management, or I have a question about something, that the Herjavec team's awesome at, putting us in contact with our peers within the CISO community. So that enables us to interact within our Herjavec customer base to, again, share lessons learned, share what they see going on. So not only are we able to work with our managed service provider, but our fellow peers in the field to really do that it's a great resource to have that on top of what we already have, with HIMSS, our ISACA groups, and other security and networking events out there. So it's just another value add to the services that you get with HG.